Hello, my name is Kyla Holton and I am 18 years old. I'm a volunteer digital advocate with NJJN who plans to study pre-law at North Carolina A&T this fall. Today, I want to look at the importance of mental health and how it relates to the Black youth in the juvenile justice system. First, let's look into the meaning of mental health. According to mentalhealth.gov, this includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Next, we need to understand what exactly is a mental health condition, illness, and/or disorder. According to the American Psychiatric Association, mental illnesses are health conditions involving changes in emotion, thinking, or behavior, or a combination of these. Mental illnesses are associated with distress and/or problems functioning in social, work, and family activities. Some examples of mental health conditions include depression, anxiety disorders, schizophrenia, eating disorders, and addictive behaviors. Today, I am talking about the criminalization of mental health issues that disproportionately impact Black youth. In today's society, we often deal with mental health in the worst way possible, by getting the legal system and/or the police involved. This often leads to young people being placed in detention or correctional facilities instead of receiving the treatment that they deserve. Or institutions that are supposed to be therapeutic actually end up feeling more like prisons, and youth whose trauma isn't actually treated are set on a path for later involvement in the legal system. According to the Office of Juvenile Justice and Delinquency Prevention, in the community, researchers have found that youth of color are less likely to receive mental health or substance use treatment. Among youth being served by mental health systems, youth of color are more likely to be referred to the juvenile justice system than their white youth. When Black youth are forced to deal with their mental health through the legal system, their conditions are often delayed or considered irrelevant. Among youth involved in the juvenile justice system, only a small percentage of those in need of services can actually access treatment. A national study found that even if juvenile justice facilities reported having the capacity to provide services to youth in their care, youth with a severe mental health condition often did not receive any emergency mental health services. Black youth disproportionately have less access to mental health care, which results in them not getting the help and support that they need. According to the American Psychology Association, studies show that African Americans are just as much at risk for mental illness as their white counterparts, yet receive substantially less treatment. In addition to this, there was a mental health delivery pattern study done in Maryland youth legal system. Here, they found that while 42.6% of white youth who met diagnostic criteria received mental health services, only 11.9% of the African American youth who met the diagnostic criteria received these services. So he concluded that the data reflected a racial bias in the provision of services. This lack of support for Black youth has been linked to their over-incarceration. Black youth are more likely to have their mental health conditions criminalized and put into the legal system versus receiving actual treatment for their mental health conditions and/or trauma. According to the University of Maryland Law Journal of Race, Religion, Gender, and Class, many researchers and observers of the juvenile justice system have noted that jails and detention centers are becoming the mental hospitals for the mentally ill adolescents who has committed a delinquency or criminal offense. Prisons are not supposed to be health hospitals for the youth, but we are constantly experiencing youth of color being thrown to the sides as they are incarcerated at higher rates while not having access to the resources that they deserve. This is especially true for African American children. African American children with mental health problems are identified and referred to at the same rates as other children. However, African American children are much less likely to actually receive specialty mental health services or psychotropic medications. Because of this lack of support, African American youth disproportionately find themselves entrapped in the legal system for behaviors deemed criminal when what they really need is proper mental health treatment. Mental health facilities themselves are also not doing their job in treating young people's mental health conditions. Oftentimes, youth report feeling like the mental health facilities are actually worse than a prison system because kids are constantly being told that they are a danger to society and others, so therefore they should not have any control over themselves. According to a Vice News investigation, one tragic example happened at a residential facility in Cozumel, Michigan. This was a facility that housed youth boys with the purpose of housing and treating children in foster care, children in the juvenile justice system, and children with behavior challenges. This was also supposed to be a place where youth were able to complete individualized therapeutic programs. Within this facility, Cornelius Frederick, a 16-year-old black boy, died after 7 staffers restrained him for throwing a sandwich. Oftentimes, the children within this facility were seen as dangerous and criminal, when in reality, what they needed more than the fear of restraint was the support and help of mental health professionals. What can we do better to help those in need? Investing in community-based programs will help keep kids out of the legal system. Therefore, the legal system will no longer be used as a mental health resource. According to community support services, people with severe and persistent mental illness needs access to treatment, rehabilitation, and support services within the community. Community-based treatment enables people with mental conditions to maintain family relationships, friendships, and jobs while receiving treatment, which facilitates early treatment and rehabilitation. This type of care is also associated with continuality of care, greater user satisfaction, increased adherence to treatment, better protection of human rights, and the prevention of stigma. We need more community-based and evidence-based treatment and services. We need to do more than acknowledge that there is trauma. We need to constantly work to provide skills that will help to prevent future traumatizing events in the youth. By investing in programs like these, we're giving support and resources to the youth while giving them a safe space when needed. Thank you guys for listening to what I had to say about this very important issue in our society today.